Hello, my name is Özgür Kurt. I'm a medical doctor and professor in medical microbiology working in Acıbadem University, School of Medicine in Istanbul, Türkiye. I have a PhD degree on medical parasitology. Actually, it is one of the neglected diseases present also in the list of the World Health Organization. It is one of the common parasitic diseases of the tropical and subtropical regions of the world. But as I said, it is in the context of neglected diseases. So because of the immigration problem, because of the global warming, it is appearing in many parts of the world also at the moment. But it's an historical disease. Mostly it is cutaneous infection, very large scar on your skin, somewhat devastating psychologically at least, and common. However, if it invades the internal organs, the visceral infection can be deadly if not diagnosed and treated early. So countries, African countries, Asian countries, South American countries, know this infection very well because it's one of the individual and public health problems there. Because they are mostly appearing in the relatively low socioeconomic regions of the world. And because of the resources are limited, the fight against them, because most of them are vector-borne diseases, and fighting the vectors and finding the patients, treating them, taking the necessary measures, public health measures, can prevent them is maybe relatively easy. But because of these limited resources, they are present, they have been present. In many of them, like dracunculiasis, another neglected disease, there is a remarkable progress, almost eradicated in the world nowadays. But because of the changing conditions of the world, the immigration problem, the civil wars, the global warming, I should say, these infections like Leishmaniasis, we have sometimes progress, but we also cannot eradicate them easily, cannot fight with them effectively sometimes. Diagnostic options we have, treatment options also we have, but of course, as I can say, as also I made this underlined in my presentation, the changing conditions of the world, evolving parasites, make these both diagnosis and treatment difficult for us. For example, we have options to diagnose Leishmaniasis. Cutaneous infection, you can, there are experienced dermatologists, there are many in my country, they can see it and say this is cutaneous Leishmaniasis. But for visceral infection, you have to make some tests and you can diagnose it. When you diagnose it, you need to find effective treatment. The old agents, antimonial compounds, there is an emerging resistance against them in many parts of the world. We have new options, we need new treatments, lots of new treatment modalities are examined at the moment. We also do similar studies. But this is an ongoing fight against the microbes actually. So as in my presentation, the parasites are changing also, trying to adapt to the changing conditions. Hybrid parasites appear and they have a risk for us to complicate the diagnosis and treatment of these infections. With our regular treatment and diagnostic methods, we may not diagnose them on time, and we may have failures in treatment, resistance problem, etc. As a scientist in working in this field, also I should say I might say, unofficial spokesman of a large group of Leishmania researchers in Turkey, in my country. We call ourselves Leishmaniacs, and there are professionals from like me, medical doctors, veterinarians, biologists, even geography experts, field workers, collect the sandflies, the vectors, etc. So when we do these collaborative studies nationally and internationally, we always receive good results. I mean, we now diagnose the problems in time. We can look for the treatment options or new solutions also in time. And yes, why not? I mean, they are changing, but we are also changing and we are taking the necessary measures. But of course, the unrest, the political unrest in certain regions of the world complicate this problem. And it is clearly explained that the average temperatures increasing, and this increases the lifetimes, the survival times of the vectors. The more time they live, the more chance they meet with the people and infect them. So we should know them, and we should take measures not in one discipline but multidisciplinary. Everyone should work together. And you know about the One Health concept. This is the solution, I think, because everyone does their own job, and then this solution comes better. Hybridization is actually a way of survival for the microorganisms or organisms in the nature. They are not, the main aim is not to make people more sick or more uneasy, but they try to adapt to the changing living conditions there. But once they are hybrids, this can complicate the problems of our diagnosis and treatment, and the prognosis of the infection worse. We have some clue I presented in my presentation, and these clues accumulated and saying that hybrid parasites are more, and they can complicate our treatment management of the patient. As a medical doctor, I deal with this part, but also molecular biologists, etc., try to unveil the genomes and other details of these hybrids. So this study, these kind of studies are essential to find an effective solution.